Hello, everybody, and welcome to episode 66 of CCA's Medical Minute video podcast, brought to you by Kroger Health. I'm here today with my colleague, Sherry Hughes, Director of Strategic Community Engagement and spokesperson for Cincinnati Cancer Advisors, and Ebony Young, Senior Vice President of Impact for the Urban League of Greater Southwestern Ohio. I got it all the way through that.
Got it right.
So anyway, thanks for joining us today, Ebony.
Thank you. Happy to be here.
Yeah, well, we're now, so we got 3 cancer survivors sitting side by side.
Yes.
So we're trying to check all the boxes, breast, prostate, and sarcoma, which are pretty unusual, particularly in adults.
Yeah,
Yes.
definitely. And we were just talking about the fact that there are 4 different types of cancers. And to present, we've spoken to someone that is, of course, with carcinomas, lymphomas, leukemias, and today marks our first time getting a chance to speak with someone who is a sarcoma. That's the other type survivor, and that's Ebony.
Yes.
Okay,
Yes.
gotcha. All right, before we get too deep into this, I need to check with Chris on something. Chris, who won our office NCAA bracket?
Unfortunately, it was Steve.
Okay, I won. That's
Steve,
right.
you
Yeah,
won?
I did. How about that?
Wow.
By
My
one game.
goodness.
By one round of 64 game.
Okay.
I usually say that guys that actually watch basketball never win, but this was one case, one rare case. So
Ebony,
anyway.
are you into basketball at all? Have you
No,
been
not
watching
really.
the
Not really,
March
no.
Madness?
Yeah, I've heard a lot about it, but not really. No.
So Ebony's case is a rare case. My case of winning the bracket, rare case. So anyway, there's
That's the tie-in
that's
there.
the tie-in.
Okay.
That's right. So anyway, let's talk a little bit about. So my knowledge of sarcoma is pretty limited, but I know it could be like soft tissue, like things that don't occur. Do they occur in bones as well, or?
I don't believe so. I think it's
I think
more
it's
soft
soft
tissue
Yeah,
based.
it's all soft
Yeah.
tissue based.
Yeah.
Mm-hmm.
Yeah.
So one day you're going about your business, you're feeling fine,
Yeah.
and then what happens the next day?
Yeah, it was 2007, the day after Christmas, actually. So the Christmas day, running around visiting family, great day, feeling wonderful, no headaches, stomach aches, anything. Everything was perfect. And the next day, I had to wake up to go to work. And I just remember waking up and feeling very groggy, like I was in a really deep sleep. And I got my phone and realized I had overslept.
Okay.
And so I jumped up to hurry up and get ready for work, and I instantly fell back down on the couch.
Okay.
And I'm like, what's going on here? I'm like, am I sleepy? I couldn't figure it out. So I tried to get up again, and it kept happening. And it was almost as though my legs were asleep out the blue, both legs.
But were they tingly or
They
just?
were tingly.
Okay. Okay.
So I laid down for a little while and, just tried to, I didn't know what was going on. Maybe I needed more rest. Long story short, I was able to kind of pull myself up and kind of get myself together. I started to have a little bit more mobility in my legs, and proceeded to go to work, which in hindsight probably wasn't the best idea. Seriously considering driving and safety. And, I was able to feel, the gas pedal and, the brake pedal, but it just, something was off, and I knew that.
Okay.
It really became more alarming to me as I was walking into the office, and I had on high heels and my legs, my feet were wobbling.
Okay. Wow.
And I knew something was off.
Okay.
I ended up, going home that night and just thinking maybe I, have a pinched nerve, just trying to think through what it could be. I was a little fearful, but I thought, well, maybe it would just pass. But it didn't pass. It got progressively worse.
Okay.
So then did you then go to a doctor, or how did you navigate through that? Did you just call your primary? And
So what I did was I contacted my primary care physician, and I just said, I can't really feel my legs or feet. And, he said, really? I said, yeah, I guess something's off. And he tested me, and he, did a workup, and he said, you need to go get, an MRI.
wow.
Okay.
and actually, I think originally he thought it was multiple sclerosis.
Okay.
So I went
So
to
I guess it's some of those similar types of symptoms
Yeah.
with,
Yep.
Well,
with MS.
and I think I think MS is something that occurs pretty regularly in people that are like 30-ish.
Yeah,
or
yeah,
whatever.
yeah.
So
And you're a
that
younger
wouldn't have been
person, so that would
unusual.
be
Yeah.
good thought. Hey, she's younger, so maybe
Yeah.
this is like an MS.
Yeah.
right.
Mhm.
Yeah.
When
So-
did they discover it wasn't?
So I had the MS workup to discover that it wasn't MS, and we did a MRI of the CT and L portions of my spine,
Okay.
and that's when we found out.
Okay.
So I remember that day very vividly. I had the MRI had to be probably about like 2 hours, 2 to 3 hours, because it was with and without contrast, and they wanted to really get into every vertebrae. And
let me ask a question.
yeah.
It sounds like a silly question, but I've had some of these myself. I mean, did you have to lay still the entire time? Okay.
Yep,
So,
had
like,
to lay still, no
Yeah.
movement at all.
That's a lot. For
That was a
almost 2
lot.
hours.
That was a lot. And luckily, I worked at the time at the hospital, so I was able to. The MRI place and my office was very close together. Maybe literally driving distance, maybe a minute and a half away. When I pulled out of the parking lot to go back into work, the neurologist called me.
Okay.
That's how quick
it was.
It was. And I remember, I would never forget this. She said, "Where are you?" And I said, I'm driving into work. And she asked if I can come into the office.
Okay.
And
You don't wanna
Yeah,
hear
when
that.
you hear that, you
Yeah.
know something's going
yeah.
on.
And I said, well, what's going on? And she says, I need you to come into the office immediately.
Okay.
And, I'm like, well, can you at least tell me? She says, I don't want to talk about this over the phone. I would prefer that you come in. And so by then, my anxiety, is high. I don't know what's going on. And I said, can you please just, tell me now? And long story short, she said, Ebony, you have a tumor, and the tumor is inside your spinal cord.
Wow.
And I'm like, well, what does that mean?
Right.
I had no idea what was going on.
Did you know by then that it was a cancerous tumor
Nope.
or it was what they call sarcoma? No.
So my mom and dad was with me. They managed to hurry up, and they dropped everything and, came to, hear the news. And I don't remember in detail exactly what she said, because it was a shock. I didn't understand how to process it. I just remember seeing a look on my parents' faces.
Yeah.
So now you've been told that you have sarcoma, and that
Nope.
You,
No,
not yet?
it wasn't a straightforward journey. So the neurologist said the good news is that this cancer is over a 90% chance that the tumor. Let me rewind. She said the good news is that the tumor typically is benign, and that there's a 99% chance that it's not cancerous.
99%.
It was like a 97,
99.
90. It was higher than
Yeah.
90% for sure.
Okay.
And she said, so that's the good news. She said, the challenge is that you need to make some serious decisions rather quickly of what you want to do with this. So I was fast tracked in Mayfield Clinic. And I met with two of their top, neurologists who were absolutely amazing. And basically they said, look, you have a tumor in your spinal cord. If you do not get this removed, you're going to be permanently paralyzed.
Yeah.
And if
Wow.
you do get this removed, the risk is still really high. We don't really know what we're getting into. It's inside your spinal cord, the shaft, the lining of it. So it was a very complicated surgery. So I ended up having to, rush to get, the surgery done to get the tumor removed. They removed some bones in my back because it was so much inflammation, they couldn't put the bones back in.
Okay.
And then I was in ICU for about a week. And then after that, I had to do rehabilitation at Drake Hospital, where I had to learn how to walk and brush my teeth
Like
and
occupational
feed
therapy
myself.
type stuff. Yeah.
Because it's just the incision. It was in a T4 of my
Okay.
spine. And that incision, and plus,
Right.
it's your spinal cord, so that's responsible for so much of your mobility. So I had to literally learn how to do all that stuff over
That's
again.
amazing.
And then while after the surgery, they were doing pathology on the tumor, and they couldn't figure out what it was. So they, I believe it went to like MD Anderson and went to a couple of different places. It eventually went to Emory, where
Okay.
they found out that it was a sarcoma.
Wow.
Okay. Wow.
Yeah.
So, and how much time's passed in between the MRI and when someone definitively said, "Here's what you've got"?
I would say it was probably over 3 months. It was about 3 or 4 months.
So,
That's a
And
lot of
because
time.
at that time, so think about it, after my surgery, I was in rehabilitation.
Yeah.
So, I went to, Drake Hospital. I arrived on a gurney in an ambulance, and I left on a walker.
Okay.
That's how much great progress I made in that 30-day
in the
period.
30-day period.
Wow.
So
It's an
when
amazing
you
story.
found out that it was a sarcoma, which is a form of cancer, after that, were there additional treatments? Like,
Yes.
I had to go through chemo and radiation, immunotherapy, and adjuvant therapy. What did you have to?
Radiation.
Okay.
Yep, I went to. So it was the cancer. It was so challenging because they never seen that type of cancer, in the
It's not a
spinal
contest
cord.
you want to win.
So it was one of those things where they were being, the care team was being very thoughtful about, where can I get the best care for this.
So you're a miracle.
Yeah. Yeah.
Because when they
Sounds
say
like-
there's 90+% chance that it could not be a
Right.
cancer, and it
And
ended
it
up
was,
being a
yeah,
cancer.
yeah. And it was a very just complex case. So I didn't have, my children were small. It was just a lot going on. So we decided to actually get my treatment here, which was, phenomenal. So I had to, receive radiation treatments Monday through Friday for 7 weeks. It was like localized radiation.
What do you do now for surveillance, or is there any kind of surveillance?
So it's interesting because in reading more about the cancer that I had, the recurrence rate is like 80%. And
80%
That's a
recurrence.
very high percent.
And there, from the studies that I read back then, and I haven't researched it recently, but there weren't any like documented survivors after like 7 years. So
And
they
how
were
long has
very
it-
aggressive. So 14, going on
Wow.
14 years.
So you're
yeah.
you're
amazing,
defying,
That's amazing.
all kinds of statistics or whatever. You
Yeah.
really are a miracle.
Yeah,
Ebony.
yeah. Just thank God, it was a very, very challenging time. But, once after my surgery, and once I went through the first round of radiation, they were very hyper vigilant about I had to get scans often.
Yeah.
And then after a while, it was reduced to quarterly, and then, semi-annually, then annually. So, yeah.
Wow. Okay.
Well, you know what? I have a few statistics, and I want to make sure that people that are watching understand. I think we said that it's very rare to get a sarcoma. Only about 1% of all the adults would have this type of cancer. And about 15% of childhood cancers are sarcomas. Also, approximately 16,000 are diagnosed in the U.S. annually. That's how many.
It's not that
That's
many.
very
Right.
few.
Across-
Yeah,
out
it
of,
is.
Out of 330 million people.
Yes,
Yeah.
that's right. But
Yeah.
Steve, you were mentioning something very interesting because we were talking before you got here, and we were talking about sarcomas, how rare they are. But Steve, pets can actually get sarcomas
Yeah.
because you said you had a pet that
Yeah,
has
so
sarcoma.
yeah,
Oh, wow.
so our dog, little dog that we lost not that long ago, he lived with a type of sarcoma for about a year and a half, which was, particularly for a dog, was a long time.
Had you heard of sarcoma prior to that?
Not really, but I believe Jean Robert, the
Okay.
famous Cincinnati chef, I think had a form of sarcoma.
I think I remember hearing that. Yeah.
Leiomyosarcoma or something like that. But also, I mean, from the moment they started talking about that, they said it was a very rare cancer.
And earlier we mentioned, Ebony, that we didn't think it was bone, but I had some information that says sarcomas do grow in the body's connective tissues.
Okay.
cells, which include like fat, blood vessels, nerve, bone, muscles, and cartilage. So anything that's not an organ or whatever, that's, you know, connective tissue wise, that's where you can find a sarcoma developing, if one would. So we heard also that our founder, Dr. Barrett, was on your team of physicians.
Yep. Yeah. Dr. Barrett was and still is, you know, my oncologist, and he really, just the care that I cannot say enough about Dr. Barrett and how life-changing he has been for me and my family. Not only just the technical skills and the surgical skills, but just seeing me as a human being and being scared and being a mom and not knowing if I was going to, you know, survive. And it was a lot. It was a lot to process, but, you know, he and his team were absolutely phenomenal. And has always been. I have a soft spot. Anytime someone mentions Dr. Barrett, I'm like,
But the funny thing about him, if like you were to say all that to his face, I mean, like he would be looking down at the shoes.
I know.
He wouldn't want to hear it. So, he's just a humble, really just great human being.
Yes, so. He is.
So I guess we'll go ahead and wrap up. But this is to summarize. I mean, it seems like to me. So we're saying 1%.
Yeah, 1% of all adults.
Think about these numbers that she heard. Like, so 1% there, 90+% chance it's not cancer. You get cancer, 80% chance of recurrence, hasn't recurred.
Yeah.
Truly amazing.
Well, the one that stuck out to me was she said that 7 years was the pretty much no one had survived past 7 years, and you're on what, 14?
Yep.
So now are they studying 14? You, Ebony?
No, I haven't had no one's outreach to me
She
yet.
wins amongst the three of us.
Yes. Well, we are so fortunate to have you sharing your story, and we know that it will help lots of other folks. And I think also when something is wrong, you know, immediately we want to try to self-diagnose and try to figure it out. But you just have to get in there and make sure that you get yourself checked out.
You have to. You have to be able to advocate for yourself and advocate for your care. Yeah, for sure.
And just so you're not surprised, cyber stalking campaign's already begun. So I sent you a LinkedIn invitation today.
Okay.
So if you're like, who's that guy? I'm that guy. All right.
Well, I would gladly accept.
All
Thank
right,
you.
sounds good. All right, thanks so much, Ebony.
Thank you.
Thanks, everybody. Boy, what a great story.
I almost have tears.
I know, it's crazy. I don't cry, but if I did, I would cry over this. But anyway, we'll see you here again next week. Thanks, everybody, and take care.